Hello, and welcome back to my YouTube channel, DR23. Thanks for joining. Yeah, if you haven't subscribed, make sure you click that subscribe button. Make sure you like the videos. Make sure you click on the bell so that you get notifications anytime any new video drops. Also, today we want to talk about another interesting topic. The last time we talked about changes that happen in the first 3 months. This time, I want to talk about changes that happen after giving birth. Because there's a popular adage that says that when a woman gets pregnant and after delivery, the body is never usually the same. There's a Yoruba one. It's a Yoruba one, but let me not. So what are the changes that happen to the woman after she has given birth? It's very interesting. I've tried to divide this into two: the physical changes and the emotional or mental changes that happen. When we talk about the physical changes, one of the major things that happen, after one of the commonest complications, I would like to put it as complications. One of the commonest complications that happen is what we call postpartum hemorrhage, whereby after baby is out, placenta is out, the bleeding just don't stop. And usually this can happen due to various reasons. The uterus not contracting well enough. The woman could have a cervical tear. She could have a poorly repaired vaginal tear. Especially when the babies are big and then the babies are the one that tear So when the repair is not properly done, or the doctor or the nurse or whoever does it did a very shabby job, the person can still bleed later, then cause some level of bleeding that can warrant what we call postpartum bleeding. Usually, postpartum hemorrhage is usually very simple to handle. If the point where you know what the problem is usually very easy. But sometimes when you don't know what the problem is, it can be crazy. And trust me, postpartum hemorrhage can lead to death. Another very common thing that happens is what we call puerperal sepsis. So one common thing I've seen in practice is when women have their children after delivery, especially vaginal deliveries, then they say, okay, when they send them home, they have different practices at home to try to heal the wound. They have different practices to try to do what we call involution. Involution is when the uterus goes back to the pre-pregnancy state. They have different techniques. I've seen people saying, sit on this, sit on that. Some sitting can be beneficial, but some are definitely not beneficial. So it depends on the practices. Some people use herbal concoctions, and this can lead to infection on the wound. So puerperal sepsis is when there is infection either in the uterus or around the vaginal area after delivery. And this also, when they come to the hospital, sometimes they have very bad wound breakdown. Some of them have very bad odor and all that. Another common one that I've seen also is poor care of the CS scar. When there's CS, there's this we call it the phanesteal incision, that scar just below the abdomen area. And when the woman goes home, they tell her, okay, come for dressing so and so time. Or sometimes they say clean the wound so and so time on your own. And then we see people applying all sorts. I've seen people apply all sorts to CS wounds, and they come back, the wound is broken down, and then those are some of the common things we see after delivery, and usually it's not palatable. It's not palatable. Another common thing that I see again that is mastitis. When there's enlarged engorgement of the breast, and then the woman is not able to breastfeed as much as the woman is not able to let the milk come out as much as often as possible. So this is the commonest scenario that I've seen. This is how it played out. When a woman is supposed to start breastfeeding, sometimes they are not used to that frequency of breastfeeding, so they tend to want to hold back a bit, breastfeed a bit, hold back a bit. Sometimes they want to look at how the baby's demeanor is before they breastfeed. But unknowingly to them, the breast just keeps getting engorged. then it starts to give them a lot of pain, a lot of fever, and at the end of the day, some of them will come to the hospital with pain, fever, and rigor. They start shaking. Usually when they come like that, the treatment is usually very easy. Give a few medications, maybe some injections, and teach them to always try to express as often as possible, because the expressing really helps, making sure all the lactiferous tubes are working and not giving chance to clogging. Yeah, it will really help. Another one that I've seen before is deep vein thrombosis. Deep vein thrombosis on its own is common in women who are pregnant on its own. Pregnancy is a risk factor for deep vein thrombosis. So deep vein thrombosis now still can come after pregnancy, especially women who do CS and are left on the bed for a longer time. They are even prone to deep vein thrombosis more. So usually when women have CS, we just encourage them to stand up the next day, so that once they keep the lower leg, the legs moving, then it reduces their chance of having deep vein thrombosis. But then deep vein thrombosis is also something that I've seen a lot of times, in postpartum period, and some of them have to even use the drugs for as long as, say, maybe 6 weeks. Some have to use medication for about 6 months. I think I know someone that used for like 6 months. Yeah, the post delivery. Before she could get that the clots totally properly dissolved and cleared off to go home. So the emotional part of it is postpartum depression. Postpartum depression is can range from what we call mild blues, postpartum blues, to what we call proper postpartum depression. And postpartum depression is dangerous. Occurs in the first 6 weeks, or after delivery, where there is this feeling of overwhelmingness of activities. It's important for women to know that once you have a baby, everything changes. Once you have a baby, nothing is the same again. Everything changes. So you now have to program your mind to what type of change are you looking at? A positive change or a negative change? I will implore you to look at it as a positive change. And one of the major things that is also very important is support around women who have just had their babies, because it is very important, because this is the point where everything in their life changes. A baby is crying, the breast is full, she's nursing the wound under her, everything comes crashing down. The husband is there, the mother is there, everybody's there, baby is crying. So they just become very overwhelmed. And I've seen cases where women say that they just don't want to see, they don't feel like seeing their baby. At that point, I just want to be kept away from the baby. So we've seen reports of women trying to suffocate their babies because they get into postpartum depression. Howbeit, there can also be some anxiety part of it, that comes with it. But it's all very important that women who have had anxiety or depression episodes before pregnancy make sure they get enough counseling before getting to this postpartum stage. Other things we also talked about, on my WhatsApp group, is people talked about them forgetting things easily after delivery. Yes, there's this part of the body that just gets lost, in quotes, because you just can't remember things anymore. People, science has been able to attribute it to some form of hormonal changes that occur, or some form of reduced some hormones are reduced. Some female hormones are reduced as the woman grows older, so they tend to forget something. Some have also told me that they had some form of vaginal prolapse. So prolapse is when some part of the vagina is protruding out, and so a lot of changes occur when women deliver, and it's important to know that one of the major things you can do is education. When you are properly educated about these complications, then you can prepare for them. So when they come, it's also important that when you experience these complications or these changes, it's important that you do not close your mouth. It's important that you speak up. It's important that you speak out, because your help can be out there. If you found this video useful, please make sure you watch it, send it to people, click the like button, put in your comments, and I'll see you again next time. Thank you very much.